Hello, I'm Dr. John with Voyage Clinics. Today is a wonderful podcast that we have planned. Darrell Moon is a friend of mine, and I'm excited about him. He's really renowned all across the nation as a big advocate in the direct primary care space. As you know, my clinic is a direct primary care space clinic, and it's lovely, and it's been really fun to run that clinic. Darrell, hi.
Hi.
Welcome to the podcast.
It's a pleasure. Thank you.
I usually give my podcast guests a piece of serenity wood.
Oh,
and this is like
cool.
something that I make. It's kind of a calming piece of wood.
I know. I've seen this in your office. I'm pretty impressed. Yeah, that's nice. Thank you.
We call this one buttery salmon because it's like shaped like a...
so you actually make that particular piece?
Yes, they're all unique.
Times.
They have different kinds of different... They're every single one is unique and handmade by Dr. John.
That's cool.
It's my twitch, I guess. I do this in my spare time. Nice. It's calming and therapeutic. Nice. Darrell, very good. Darrell Moon, nice to see you. Let's talk a little bit. Give us a little background about your journey, kind of maybe a little bio information. That'd be really great.
Sure. In fact, being here in Orem, Utah is sort of where things began for me.
Well, okay.
I wanted to be a hospital administrator. You know, going into college, I thought I knew somebody that was. They'd opened up a brand new hospital here in Utah, and I just thought it was exciting. You know, it sounded like a great thing to do. And so I started to research, where should I get an undergraduate degree? Where should I go get a master's degree? And anyway, that whole thing led me to understand that I needed some experience. And so I was going to Brigham Young University. I was living in Provo. We just moved from Orem down to Provo, and I went to the local big hospital, and I said, can I come work here? You don't have to pay me. Just let me empty the trash. I just want experience because I need it to get into a Master of Health Administration. They said, no, you'd be in the way. Best no I ever got. So I thought, well, I can come all the way back up to Orem where there's this little maternity hospital, kind of a long ways away. I don't have any car that can get me up there, but I'll go see if they want some help. And Larry Carter was the administrator, and here he was with just a couple people trying to run this little maternity hospital. And he said, I would love your help. In fact, see that box over there? We just bought our first, this is back in the early 1980s, IBM personal computer. Wow. And we have no idea how it's going to help us run this hospital, but you could help us figure that out.
Wow. I bet you've seen some incredible,
just incredible things. We got to renovate the hospital, go through the architecture. We got to reconcile bank accounts and old accounts that hadn't been reconciled for years. It was just I loved it. I went to school in the mornings, went to my classes, got on my bike, rode up to Orem, and had a blast. Just had a blast. I was eating it up. And so I was, thinking, okay, this will give me the experience to be able to go back to Washington, D.C. and go to George Washington University where they have a great master's program, or I go to Minnesota where they have a great program. Anyway, Utah sunsetted the certificate of need law. First state in the country to sunset a requirement where you had to certify there was a need for a hospital bed before you could build one.
Oh.
So all of a sudden, all the big companies across the country wanted to build hospitals in Utah. Well, the easiest hospital to build is a psychiatric hospital. And so 8 companies across the country all bought land and started building psychiatric hospitals within like 2 years.
Wow.
The first one to open happened to be a company called Charter Medical. And so they came to Orem Community Hospital and talked to my boss, Larry Carter, and said, how would you like to be the administrator of this new psych hospital we're building in Orem Community, or in Orem Hospital, or in Orem, Utah? Well, he took the job and came to me and said, Darrell, how would you like to come be one of the only 2 people in the hospital who works for the corporate office? Would you like to come be the CFO controller of the hospital? And I'm like,
wow.
I'm just a student going to BYU trying to get an undergraduate degree. You want to give me the job today that I want in 20 years after I graduate? Yeah.
Take it.
Sign me up. Well, that led to me working for 10 different hospitals all across the country. Didn't stay with Charter long, opened up another hospital for them in California, but most of the hospitals were for Hospital Corporation of America, the big one.
Yeah.
Some were med-surg, most were psych. But I was fascinated by Edwards Deming. Do you know who Edwards Deming is?
No, I know HCA, but I don't know Edwards Deming.
So Edwards Deming is the grandfather of the Net Promoter Score, Google 5-star ratings, Six Sigma, total quality management. I mean, it's like he was the impetus behind this country now pretty much doing business the way we do business. And he came up with this just some basic principles of how a company should run their company related to their customers. So he basically said, first define your customer. Then figure out what's going to delight your customer. Like delight, inspire, engage your customer. And then find the processes to measure the impact delighting the customer the most. And then when you see variance in those measurements, get the people closer to the process to improve the process. Well, he went to Ford and General Motors and said, let me help you build better cars or better meet your customers' needs. And they said, no, you'd be in the way. So we went to Japan. And you know the rest of the story. Toyota and Honda figured out that what customers wanted were cars that lasted. That was what delighted the customer. So they started building cars that lasted, and they still have that same reputation.
Yeah, today. Yeah.
Because they simply followed Deming's principle of figuring out what's going to delight the customer. So here I am at the top of the food chain in the largest industry in America, healthcare. And I'm starting to look at the entire industry through the lens of Deming. And I said, well, first thing you do is you define your customer, right? Well, when you define the real customer of the healthcare industry, there's really only one true customer who's paying for this $5 trillion industry. It's business leaders.
Yeah.
I mean, they're the ones who are saying, I'm willing to put out the second largest cost in doing business towards this industry. And I couldn't help but think, well, if that's my customer, how is it that I get away working against my customer every day? I literally get rewarded and bonused and recognized for keeping my hospital full. There's not a business leader in America that wants me spending all my time figuring out how to fill up my hospital beds. I'm like, this has got to be the most broken industry in America. It has to.
Because you're not even serving your customer.
Not even. I mean, I'm literally scheming against them. It's like, how does this happen? Why is no accountability in the largest industry in America? How is it that there's such a huge distance between me running the hospital and the guy or the gal spending the money? And I said, I cannot dedicate the next 30 years of my career to an industry that's not working for the customer. So I left the treatment side of healthcare. And ever since, I have been passionate about fixing healthcare and getting in front of business leaders and showing them that they have all the power to fix healthcare. They just don't think they do. So I spent a lot of time doing that. Well, that's sort of what got me to then discover the best healthcare system in the world, which then put an exclamation point on what you do. You want me to go there?
I kind of do. I've heard this story, but I like it. And I think highlighting, I felt the same way. So as I went into medicine, went into medical school, I'm from a small town. I like taking care of people. I like relationships. And I went into this system, and I was plugged into it out of medical school as this greenhorn doc that was very altruistic, and it was really hard. It was kicking against my core values as well. Like mine is my client is my patient, and I want to take really good care of that client. And I found the system with the constraints, with the incentives, with all the things that were in that system, largely dealing with insurance companies and administrators like whipping me to see more patients per hour.
Exactly. It's by design.
It was brutal. and I started to misalign with my value of taking care of people. Yeah. And 8 years ago, I stepped off of that system and started Voyage Clinics as a move toward something better, something that aligns with my client. And that's what you're talking about, is that, man, I'm not even aligned with my patient, like with exactly alignment. Yeah. Let's go there. Let's talk about an interesting healthcare system that you explored. I believe it was in Alaska.
It was. So 6 years ago, I came across, I didn't know there was a healthcare system that we could put on a pedestal and say, there's the best healthcare system in the world. And when I was listening to a podcast by the medical director of this system, I was blown away. I sat there and was dumbfounded because everything that I had believed that we should be running healthcare like, he's telling me that they've done that for 25 years and how well it's working. And I'm like, I knew it. It's like, I knew that's what we needed in healthcare. And the fact that somebody's got out and hacked the system, it's like, I asked them, I said, you have the best healthcare system in the world. Countries from all over the world are coming to Alaska to learn how you do this amazing system. Does anybody ever come up from the lower 48? Not very often. And I'm like, this is nuts. So I've used my podium, which is to speak to CEOs across the country, to just wake up the buyer, the customer, to say, why are you putting up with a system that's so expensive that doesn't even do a very good job when there's something much better? So this is called the Nuka, Nuka system of care. It's a healthcare system. They describe it as an aspirational healthcare system. It has the highest level of customer satisfaction in the world, 98%. This is 70,000 people that they take care of. It has the highest level of population health improvement. They've taken their population from the lowest level of population health to some of the highest. They have the most incredible recognition. I mean, internationally and nationally, they're the only healthcare system that's won the President's prestigious Malcolm Baldrige Quality Award twice. You have to wait 7 years in between even applying for that award. They're the only healthcare system that's won it twice.
Wow.
And the most incredible thing is they spend half as much on healthcare as the rest of us in this country. It's like, what customer of healthcare, CEO, wouldn't want to know that there is a better system that's going to cost them half as much, is going to do a much better job for their customers, their employees.
Right.
It's like, we just need to get the word out. So the story behind how they created the best healthcare system in the world is a fascinating story. When the federal government many years ago acknowledged that when they stole the lands of indigenous peoples, tribes across the country, and gave them healthcare in perpetuity for free in return, they finally acknowledged that they had done a great disservice to tribal people across this country and said, look, we acknowledge that the federal Indian healthcare system is terrible. Flat out. We know it is. It's one of the worst. And if any of you tribes or groups of tribes want to build your own healthcare system, we will let you, and we will divert our money to you and let you build your own. So they went out and did something that nobody else had ever done before. They asked their 70,000 customers what they wanted from a healthcare system.
Super weird.
Wow.
Yeah, new concept.
Healthcare is usually built on this idea that I go to school for 10 years to learn about a particular part about this amazing organism called the body. I put up a shingle and I say, come be the benefactor of my great wisdom. And if you don't know what I tell you, I'm going to call you non-compliant. That's how healthcare is built. Well, they went out and asked their customers what they wanted. And the customers said, well, we don't want a paternalistic system that just tells us what to do. In fact, we want a healthcare system that's a guest at our table, that's journeying with us on our path of life, that's actually helping us reach our dreams in life, our goals in life, our aspirations in life. And if and when we do fall off a cliff or we get sick, we already have a trusting relationship with a healthcare team who we know we can contact 24 hours a day and expect to get perfect care, coordinated at every level. That's what we want.
Yeah.
And this group called the Southcentral Foundation, that now calls their healthcare system Nuka, set out to build a healthcare system to meet the customer's needs.
That's so fun.
And the fundamental part is what you do in primary care. So I'll let you say what you're going to say. What were you going to say?
I love it. And I just love that discussion. And I often, in talking to my clients, my patients, I tell them, like, because I have a nice team. I've got a couple of nurse practitioners, a couple of family docs, some therapists, a chiropractor, and we're all working to help these folks on their healthcare journey. And I often refer to us as their Sherpas.
Yeah.
Because we're not paternalistic, we're not dictators telling you have to do this or that. Instead, we're carrying some things for you, and we're talking to you, and we're listening to you, and what would you like to accomplish in this journey of your healthcare? And that's largely why we named it Voyage Clinics, because life is a journey, healthcare is a journey.
Well, and can I take that one step further?
Yeah.
Because what the Nuka system did is they acknowledged that it wasn't their healthcare journey that they needed a partner on. It was their life's journey they wanted a partner on. If you ask anyone, what does good health mean to you? The most common answer you'll get is just getting to do what I want to do and not letting my health get in the way. So the real journey that Nuka said we're going to help you on isn't your healthcare journey. It was your life's journey. And let us be, as healthcare experts, help you reach. It's like if I want to make a 3-point shot, I got to have enough health to get on the court to even take the 3-point shot. But if my passion in life is to be the best 3-point shooter, how is my healthcare team going to help me accomplish my aspirations in life? And so they recognized that what they did to build this amazing healthcare system was they took their 70,000 members and they divided them up into groups of about 1,000 members each, mostly around tribes and families. So there was some relationship there. And they said that we're going to take a doctor, a nurse, case manager, a medical assistant support person. We're going to say, you are assigned to these 1,000 people. And your first job is not to be a doctor. Your first job is not to be a nurse. Your first job is to be on their journey with them as a trusted support in helping them reach their dreams and aspirations in life. And when they fall off a cliff, because they now trust you, you are available 24 hours a day to make sure they get perfect care, same day, coordinated at every level. And built what you've defined as direct primary care in your Voyage Clinic, they built a system on steroids. And then they've wrapped it with all kinds of ancillary services, and literally almost everything can be handled in that primary care setting.
So that's almost exactly what the direct primary care docs are creating nationally with their clinics. And it's interesting that, it resonates beautifully. Like the average direct primary care clinic has about that many clients, like from 600 to 1,000. It's pretty average, and they're just doing everything they can to build that trust, build that relationship, and help them on their life's journey, which includes caring for their healthcare needs. I teach medical students at my office, and I have 2 medical students now because one extended by a couple of weeks. I usually don't overlap like that, but we were just talking yesterday about the power of trust in healthcare. It's not something taught in med school. It's not something discussed or anything. And what's happening is a degradation of that trust over time. If you look out there, the clients, the patients, they're like disenchanted with the product of that service. And understandably so. A 5-minute visit scheduled 3 weeks out after waiting 45 minutes in a waiting room, and the doc is on the computer the entire time, not making eye contact. That erodes trust. Yeah. And I showed them, that the power of trust can't be understated. Like, it is so, so important. Way better outcomes, 30% better outcomes if you trust me and we're talking and I'm trying to help you on your journey. Conversely, the opposite happens, 30% poorer outcomes without that trust. And I'm just glad you mentioned that. And having a team environment, which I've worked for 8 years to build, I've got a nice team now. But it was hard when I first started. I only had me and trying to build this from scratch. I wish we would have met a lot sooner. But carry on. This is super cool.
Well, I think you just brought up one of the most important things that this best healthcare system in the world proved, and that is that relationship trumps science in healthcare.
Yeah.
Now, that doesn't mean that medical science isn't important. It just means that relationship is that much more important. In fact, I'll tell you, one of the things that impresses me the most about this system, built by 190 tribes of Alaskan Native people that I've grown to love and respect incredibly, is that every decision they make is with the 8th generation in mind. They make decisions based on what's that going to have an impact on my great-great-great-great-great-grandkids. We don't do that. It's like today. What am I doing today? What's the next quarter's stock price and how do I impact it? And so they built this system with the idea that they're building something for the future. And when you go to their conference, and I highly recommend anybody going to their conference, not even if you're not even in healthcare, just because it's such an eye-opener in terms of how they do quality. But there's a 5-day conference they hold, generally the middle of June every year. People from all over the country, all over the world come to it. And the first 3 days, like over 50% of the entire conference, you go through, you get to experience what they call the core concepts training, which is a training that every doctor, every nurse, every housekeeper goes through that teaches how to build trust. It's like, that's how important to this healthcare system trust is. Most of the everyone has to go through trust training, and to build trust, it's such a beautiful process that they teach you on. They teach you how to create a relationship with someone through vulnerability and confidence and connecting and listening to people to where they're willing to share their story. You asked me my story when we started. Yeah. But it's not just the story that you're listening to that builds the trust. It's how you respond to their story. And this is the part that just blew me away. It's not about what questions you ask. It's not about how you dig deeper into the story. It's how you show genuine appreciation for the fact that they were willing to give you that gift of sharing your story.
Oh, yeah.
Does that just melt your heart?
That's good stuff.
They teach that to every doctor, every nurse. And it's not just a one-time training. You go through ongoing training throughout the year to remind you how important trust is in healthcare.
That's beautiful. I hadn't thought of that. I think as family docs, we help folks navigate these spaces so often, and we are pretty good at that trust piece and showing love and empathy and validation. I hadn't even thought about training that to other staff members and other members of my team. It brings an interesting story to mind. Just it's actually a couple of weeks ago, there was a young man, he came in, and our first visits, we often spend an hour at least. And a lot of that time is doing just this.
Get acquainted.
I share some things about me. I'd like to hear some things about you. Tell me about your journey. And there's something special about that process, even just among friends, building friendships. Like, this is a beautiful process to build trust and love one to another. I think it's important. And he came in and he, hey, where are you from? What you doing? And tell me about your journey a little bit. And he started telling me, and then I told him a little bit about me, and then he just got really vulnerable. And he went deeper into what he's really going through, because he felt that validation. He felt that he was safe to open and share deeper things. And he did share some really hard things. And again, we're Sherpaing, right? Yeah. We're carrying bags for folks. And
can I tell you a story?
And yeah, just let me finish with this one. But he was sharing this like emotional trauma stuff, and really, really heavy. And he was weeping, and I wept with him, and I gave him a hug, and he said, thank you. And I said, well, thank you for being willing to share with me. Like, this is special stuff you're giving me, and I cherish it. I think it's so, so important. And he says, thank you for seeing me. You see me. And I think that's so neat that this health system is teaching that to all their people. That's cool. And
the fact that you were willing to say thank you to him and show gratitude for the fact that he was vulnerable to share stories, like, that's what builds trust.
Big time.
A story that the CEO of the Nuka system tells. I love to share her story because it just shows how, after 30 years of building the kind of healthcare system that builds trust, so she and her son are headed off to the clinic for a visit, and her, 4, maybe 5-year-old son's in the back seat. And the son says to the mom, when we get to the clinic, I want to visit with now I'm going to try to remember what they call it, the behavioralist, they have a name for it, and I'm drawing a blank. But anyway, the person who's kind of like the behavioral specialist.
Yeah.
And she's like, oh, okay. Like, why? He goes, well, Mom, my friends are all having sleepovers, and I got to get out of this pull-up. So this little 5-year-old had been enough involved in this trust building system that he felt comfortable talking to the behavioral specialist when they got to the clinic about something incredibly personal. And when they got there, this older, young man walks in, that's the behavioralist, and he's kind of like, Mom, can we talk alone without you first? Like, I trust this guy and I want to share with him, I got this problem I need to resolve, and Mom will bring you back in after we kind of talked about it. But it's like a 4 or 5-year-old has been indoctrinated in a system of trust to where they're going to the doctor's office and they want to talk about getting out of their pull-up.
That's cool.
Isn't that cool?
That's so cool. I see this model. It's beautiful. I'd never heard of it before we met and we talked, but listening to the stories, listening to the journey there, it is almost identical to the direct primary care movement nationally that's going on.
Which is what we're doing now across this country. Over the last 6 years, I feel like I'm trying to make a difference, waking up business leaders, waking up large companies and saying, you know what? You should be paying for direct primary care for your employees. And now some of the largest employers in the country are doing just that. Companies like Ernst & Young, Pitney Bowes, Prudential Financial, Lindy, and now 65 other companies are, over the next 2 years, going to bring 6 million people and say, we're willing to pay 100% for you to see Dr. I'm drawing a blank, Sanders at Voyage Clinic. So it's going to cost us more in primary care. There's no question. Our 3% right now of the 100% that we're spending on healthcare, we're going to be spending 2-3 times that much. But you know what? By investing in better relationship-based primary care, we know it's going to have tremendous impact on saving money on the back end. It's going to create much better productivity. It's going to give our employees a whole lot better experience with their healthcare system. It's going to create loyalty, which is what we want in the first place. It's like, it is one of those ahas that every employer in the country should wake up to and say, yeah, I want a health plan that I'm offering my employees where I'm not going to force them. I'm not going to tell them they have to go see Dr. Sanders, but I'm going to say, I'm willing to pay for you to go see Dr. Sanders. Yeah.
To give them the option. We have several companies that we take care of locally, and the ones that sign up all their employees, some of their employees, they have other doctors that they see and they're used to seeing. But over time, it's interesting what occurs as 1 or 2 of them come in and they get seen and they're like, whoa, this is different. This is totally different. I spent an hour getting to know this team and they have an awesome team. And then they'll go back and tell their friends, and then we'll see a few more. And then over time, it's interesting to see what occurs as that trust level continues to evolve. You see one of my companies has like 50 something employees and their utilization of their insurance just continues to go down over the years that they're with my clinic because their utilization at my clinic continues to go up.
Which is the way it should be.
And it's wonderful care. It's available, accessible when they need it. It's very affable. It's high quality. But what's interesting is I went to the CFO and I said, hey guys, like you guys have been investing in direct Voyage clinics for a while. Like, is there something I can do to help you guys? And they said, what do you mean? I said, well, I don't know. Is there some financial hoop jump in that we might do to get better money or something? Because surely your claims data is improving over the years since you've invested in this movement. And they said, you know what? We've never really asked our broker for that because our insurance just keeps going up by 10 to 18% a year. And he said, like, it sucks because we hardly ever use it as a company. And I said, well, why don't you ask the broker to run the claims data over the last 5 years? So he did it. And it showed this decline.
And we're going to cost you more every year.
So I said, well, maybe you can negotiate that, claw back some of that 18% increase that you had over the last 5 years. And he said, well, I wasn't able to do that. But surprise, right? But I was able to get a 0 increase for this year.
Nice.
Which is like 10 to 18% awesome on his second biggest expense. You mentioned that, healthcare coverage is the second biggest expense that an employer is going to spend outside of payroll. And that's so true. And if we can mitigate that just a little bit with good, high quality, relationship driven primary care, put that in the middle of your company. Will you see immediate change? Maybe the first year, but definitely second year, definitely third year, fourth year. It's just going to continue to to change as you put that in place?
Well, can I share with you an even more impactful impact that it has on companies?
Yeah.
So when I get in front of a group of CEOs, and I've talked to over 1,000 over the last 14 years, I love to ask them the question, why do you buy healthcare? And they look at me like, what do you mean? Because I have to. I'm like, no. Peel back the onion just a little bit. Tell me why you're willing to invest so much money into offering healthcare benefits. Well, if I don't, they won't stay. So I want to attract and retain employees. I'm like, okay, good. That's what everybody else tells me too. You're all doing it to create loyalty. So do you ever measure to see how well it's working? No. I've never had a CEO ask their employees until I come in and talk to them about it. Hey, how well is this money that's costing me so much, this healthcare expense, working to even get you to come here in the first place? Did it have anything to do with attracting you here? Is it doing anything to help you decide to stay here? And most of the time they'll say, no, it's sixes. I can go anywhere and get the same thing. It's like, wait, so you do it for loyalty, but you're not even measuring to see if it's working. Now, let me ask you this. Does the people in charge of buying healthcare within your company get any kind of an incentive or any kind of a reward or recognition for increasing those loyalty scores when they go out and buy healthcare? No. Well, don't you think that would be a great alignment? Oh, and what about the broker, the benefit consultant that you're hiring to represent you to the healthcare system? Do they do better when you do better on your loyalty scores? No. In fact, they probably get more money the more the costs go up. So is this a problem for brokers to fix? Is this a problem for HR to fix? Or is this a problem for you to fix? This is you, the CEO of the company, who has to fix this. Now, let's take your kind of healthcare and let's dive into loyalty, because that's why employers buy healthcare, is to create loyalty. There's a movement going on across the country over here on the other side of HR, talent management, where let's build loyalty, let's build culture, let's build a work environment that people won't ever want to leave. Well, there's a book called The Dream Manager that takes the principle of the Go-Giver book, which is you're going to be far more successful in life if you expect to give more than you expect to receive. And it puts it into an employer who says, look, I got a lot of turnover and I want to encourage loyalty and I got to figure out how to do that. So he decides to hire a dream manager, a coach whose only job it is to help his employees reach their personal dreams. And says to their employees, this person's only job is to help you reach that dream of buying a new home, going to Hawaii, whatever your personal, build a hobby, whatever it is, that person's job is to help you reach your personal dreams. And you can imagine what happened to the loyalty. Now combine talent management and human resource benefits into a direct primary care type of healthcare system that's out there not only trying to be there when they fall off the cliff, but help them in their personal journey through life, reaching those dreams. And you just combine two huge parts of healthcare and company spend into one solution that accomplishes both. In fact, I have a client who not only gives everybody a person to help them with their dreams, like a dream manager, but he gives them $50 a month if they'll work with that dream manager. Like, I'm going to pay you money if you'll go work on your personal dreams. And then he goes one step further. He says, I will reimburse each one of you up to $1,000 a year towards your dream. Even if your dream is to build an engineering company to compete with me. Imagine the loyalty that that kind of commitment to his employees creates to working for him. Now you combine one of the best things you can do for healthcare to control your costs, which is relationship-based primary care that's helping people reach their dreams in life. And over here, trying to create loyalty and a better product for your customers. It's all one and the same. And it's going to cost you less in the end. It's like, this is such a no-brainer.
Yeah. It's so fascinating. I like that. I'd never heard of like a dream manager, but it seems like a life coach or like someone to kind of help you, accountability partner to kind of help you with anything that you're trying to accomplish. That's really cool.
Which I think I run a coaching company. And so I partner up with direct primary care providers like you across the country to say, look, I know the doctors probably not got the time to be that constant, ongoing source of support in people's personal dreams. They're out busy taking care of sick people. But let me be a part of the team that can actually have a coach involved in people's lives on a monthly basis, on a regular basis.
That's cool. I want to speak a little bit to the DPC at the center of one of these companies and the impact that might have on their on trust and on impact, but also maybe on their like utilization, maybe a self-funded plan with a DPC in the middle. Have you seen any successful?
Oh, absolutely.
Yeah.
No. So first of all, you have to understand if you are a company and you're big enough to be self-funded, you should be self-funded.
Yeah. What is that number? 100, 200?
Depends on the state, but 50 to 100, generally you can move into self-funding. Okay. And what people don't know is that when the Affordable Care Act was passed, it basically said you have to give back to, like I said before, those who pay the premiums if your costs aren't equal to 85%. So if your claims are not 85% or more, you have to give the difference back. What that does is it means if I go to a fully insured Aetna, Cigna, United, I'm working with a company who has an incentive for their shareholders to make sure costs go up.
It's perverse incentive.
It's totally perverse. So the only way you will ever change that is, and there are some good solutions for small employers, but if you're big enough to be self-funded, you should be self-funded so that if you can implement an aspirational model of healthcare like the one in Alaska and save a ton of money, you get to be the benefactor of that. And so in fact, this is probably the best statistic I can give you. The average now, Aon just came out with their overall national average of what employers are spending, not what the employee is spending, but what the employer alone is spending is $17,000 per employee per year.
Wow.
That is the average across the country.
Wow.
Now, let me compare that to plans.
So that's after they carve out $300 per paycheck to the employee. So that's just the employer part.
That's just the employer part.
So the employees are probably spending an additional $600 to $800 a month. Wow. Okay, thank you.
Getting upwards of like $20,000, especially for a family. I think the average now for a family plan is like $22,000.
Yeah.
Well, we talked about brokers and working with brokers who align with the company.
Yeah.
Some of the best consultants in the country who have completely adopted this alignment, their clients are spending between $3,000 and $5,000 per year per employee.
And that's with the DPC in the middle with a self-funded plan. Yeah.
Yep. It's the whole idea of let's give people a DPC. Let's make sure that they have things to keep them healthy in the first place. And then and this is, having run many hospitals before, this is what drives me so much crazy. We're allowed to buy up our funnel sources and we don't have to compete based on cost or quality. In fact, I was at a conference just down here in Provo at BYU about a year and a half ago. In fact, it's been 2 years now. And somebody from a large healthcare system gets up in front of the group and puts up a screen that I was dumbfounded that someone was willing to put it on the screen. Healthcare system owned primary care. We don't make any money. Healthcare system owned specialty clinics. We don't make any money. Hospital or healthcare system owned hospitals, imaging centers, and surgical centers. We make lots of money. Wow. So we own these two to create the funnel source to move people into. I'm like,
wow.
I can't believe you're putting, we all know this.
We know this.
No one's willing to put that on a slide. Why in the world are you willing to put that on the board in front of all of us? We're like, why are you saying that? We know this, but that's not what we want people to think about. And I raised my hand and I said, did you know that the largest employers in the country have figured that out and are actually paying for their employees to go to a non-healthcare system owned primary care to avoid that? Yeah. And he said, that's my point. I'm like, what? He goes, his next slide was Amazon just bought One Medical.
Yeah.
We healthcare systems are losing control of our funnel sources, and we are going to be made to compete based on cost and quality.
Yeah.
And I went, there is no more important message for the healthcare system to hear and for employers to hear that they can now insist that the healthcare system compete on cost and quality. And just real quickly, when someone needs specialty care, beyond what a primary care provider, because there's times when they need a dermatologist instead of, let me send you to the dermatologist that my healthcare system that owns me wants me to send you to. We now have access to data that tells us which dermatologist actually does the best job. And let's make sure you're sent to the provider who gets the job done best. Because when we send you to the best providers, in the long run, it's going to cost less. Yeah. Less complications, less other surgeries. It's like, wouldn't everybody, I mean, right now, what's the most common way people choose a specialist, like a surgeon? Well, they go to someone that they know, their brother who just had that surgery. And they say, who did you go to? Well, I went to this one. And did you have a good outcome? Yes, that's a database of one.
Right.
What we do is we share with the members, let's go look at the data and let's look at that provider and let's look at the rest of the surgeries that they do or the services that they offer. And let's see how well they compare up against hundreds of other doctors and hundreds of those procedures. And let's together choose the doctors or the specialists who you would want to go based on the data. And then let's pay for that at 100% and you don't pay anything for it. Oh, but I want to go see the one my brother, I want to go see that one. Fine. Then you go pay for the copays and deductibles. But it's like when you open the door open to the data and you let people see the actual outcomes, not only outcomes, but appropriateness scores and customer satisfaction scores, and you choose doctors based on that kind of data, that's what's going to change healthcare. And that's what needs to happen.
I want to roll back just a little bit to something that you said. I thought it was so fascinating, that slide deck that somebody posted up. Like, these guys are funneling, ancillary revenue back to the mothership, and they're buying up these primary care docs to do that. The average, this is old data, this is several years old, but the average family doc generates $2.4 million of ancillary revenue to the hospital that they affiliate with. They don't make money on paying the salaries to run the clinic and doing all that stuff, but they make money on the ancillaries. So having figured that out, the business companies that are paying for healthcare for their employees and incentivizing them to go elsewhere than these big shops that self-refer, roll it up into their machines. It's really wonderful, I think, to position myself as an independent person. Like, I am not beholden to this health system, that health system, these people, those people pulling me in a certain direction to funnel referrals to dermatology or orthopedics or the ancillary services. I have gone out and negotiated and found price points that are reputable, high quality, but also very affordable, that are alternatives to the $3,000 MRI over there. We can get it for about $399.
Yeah.
And that beats your deductible. And so let's do that. And so it's just neat to be in the direct primary care space advocating for individuals and families when people, whether they're individuals, small companies, or what you're talking about is more the larger companies. But I look at it all as the same because we are working together as primary care specialists and as people and companies, whether they're individuals and families, small companies or large companies, we're working together to recalibrate the landscape of the healthcare system, to shake it down to high touch, high quality, relationship driven care that's high quality, but also that's reasonably affordable, like reasonably priced. Let's navigate to that. And I think that is the benefit. One of the benefits of having a direct primary care in the middle of a self-funded plan is that I've been working these pathways for 8 years. I've been building relationships for 8 years. And while I have reasonable referral point of contacts, I think I would also benefit and I would also value a resource like what you talked about, which is, well, we've got way more data points on the quality. I moved here from Moab 8 years ago, so I'm still getting to know outcomes on my surgeons that I refer to, or I hear back from my patients. My patients are like, this was a wonderful referral, probably the best surgeon I've ever met, like excellent. And the next one might say, gosh, this was really terrible bedside manner, and I just didn't really feel comfortable or whatever. And so I'll be like, okay, well, and then that affects my referral pattern as I kind of do that. But what you are offering might be a really interesting quality tool as well. So I'm interested in that. I think we've talked about that before, but it's
can
neat
I tell
that
you my personal story with using that data?
Yeah.
So I've had numbness in my hands for a couple of years and a lot of pain. It's like, okay, I need to get this taken care of. So I got a referral from my primary care provider to go see a neurologist. They did a nerve conduction study and said, yeah, you've got pretty bad damage to your median nerve. So I knew I needed a hand surgeon to get a carpal tunnel surgery. And as I did my own study before I went, I'm like, okay, I can do it both at the same time, or I can do them one at a time. And, if I'm going to come out of that with this big bandage and a big splint on my hand, it's like, I probably want to do one at a time. So I went to the data and I said, look up in Utah, who does the best job at hand surgery, who can do an endoscopic carpal tunnel, not open my whole hand, just go in with a little scope. And I found a doctor that not only has the really great scores, but compared to everybody else was doing a whole lot more. So he had a lot more experience doing, here's one over here that's got great scores, but he does 50. This guy's got 283. And I'm like, okay, I think that's who I want to go see. Well, it wasn't in the healthcare system that the neurologist would have sent me to, because that was a whole different healthcare system. But you know what? I don't care. It's like, I'm going to the best. So I made an appointment, went to see the doctor, and he said, well, you want to do them separately or you want to do them at the same time? And by the way, the surgery's tomorrow. And I said, well, I think I want to do them separately because I don't want to be stuck with no hands for a couple months. He goes, if it were me, I'd do them at the same time. Oh, tell me. He goes, Darrell, I'm going to make a small incision in both wrists. When you're done, we're going to have a bandage over both wrists and you're going to have use of your hands.
Oh, perfect.
I'm like, well, done deal. I'm like, I'm going to do them both at the same time then. I don't have to, extend this out over 4 months. Let's just go through this once and get have I had the experience of the surgery yet? No, but my confidence in the fact that this is somebody who does a lot of them. He doesn't cut you in the palm and the wrist like most do for an endoscope. He just cuts you one place, goes in, cuts that carpal ligament, and good to go. I mean, there's going to be some pain, there's going to be some recovery, but just knowing that I can look at who does the most of that procedure who gets the best data, it's like, that's a personal story.
I think there are places in the United States that are good at doing this direct primary care, bringing on larger companies. Wisconsin is one of them. They have many, many large companies there with a DPC in the middle. My colleagues in that space, I speak to them nationally. My wife and I both help those guys, and they're doing great. They're helping the company. They're helping the employees. They're building trust. They're delivering top shelf care, and it's lovely. In Utah, we're kind of I'd say adolescence here, where we're growing. We're getting more DPCs out there. But I look forward to moving the needle in this space. I would love to continue to collaborate with you, Darrell. I think you have some really cool insights, and thank you so much for being on our show today.
My pleasure.
This has been so fun. I hope that our audience learned some cool stuff and invest in this movement. Whether you're a company or an individual or family, consider looking at this space. Voyage Clinics is a direct primary care. There's several also around, and I collaborate with all those folks, and we can take good care of lots of people and lots of employers in a beautiful way and bring affordability and transparency and availability and affability to the healthcare system. That's our goal. Thank you.
And to those who listen to your podcast, go ask your employer to do this. Yeah. Like, we can get a groundswell from the public up and say, look, I expect more. Totally. Employer, I expect more. That'll drive this.
Totally. Thank you, Darrell. Appreciate your time. Thanks.
See you.